My name's Petah Atkinson and I'm the Executive Manager of the Health Service at the Rumbalara Aboriginal Cooperative. Rumbalara is based in Mooroopna, near Shepparton in Victoria, and we provide services to around 6,000 Aboriginal and Torres Strait Islander people. Aboriginal people view health as a whole-of-life issue, not just, a doctor-nurse clinic place. So it's really important for us in our community organisation, but also the research that we've conducted, over the last couple of years has really supported the fact that we need to be looking at social determinants, but probably more importantly that we need to be looking at micro-level social determinants and not necessarily the mainstream social determinants, which are at that macro level. So employment, education, income, those things are important, housing, but probably what's more important for our community that came out in our research was having a good sense of identity and having strong, self-esteem and having positive role models, local role models. Like our research came out saying that people like Kathy Freeman and Kyle Vandercup were important on a national level, but our participants wanted to see strong local role models. So I think that's what the challenge is for Aboriginal organisations on that local level, is to develop those opportunities for people. Not only to be role models, but also to have role models, and that we need them all the way through our lives. The research was conducted using a partnership approach. So the University of Melbourne School of Rural Health in Shepparton, in partnership with a number of Aboriginal organisations throughout northeastern Victoria, conducted and authored the report and the research. And what we did is we asked 4 main questions. What are the major health issues in your community? What are the causes of those health issues? Who's most affected and how do you know? And didn't matter where we conducted the research, these major themes came out over and over again. And people said things, typical things, biomedical things like cancer, heart disease, kidney disease, those sorts of things. And then they started talking about those macro social determinants like employment and housing and income. But more and more they started talking about having broken spirits and being dispossessed from country and disconnected from community and, like I was saying, having low levels of self-esteem and having their identity questioned. Like I remember one of the quotes where one of the participants said, well, if you're fair-skinned, why would you say you're Aboriginal in Australia? And and it was sort of strange that we keep promoting our Aboriginality even in the face of all this adversity and racism. The other thing that struck me really strongly, I think, as a researcher, was that that people said things that I knew, but I didn't know everybody else in the community felt the same way I did. And I remember this young fellow one time talking about how important it was to have a positive role model, a male role model in his life, and that he said, like, I don't have my father around, so I need to spend time with a man in our family, so I can develop to be a good man too. And he said, and unfortunately for me, the only male in my family is my uncle, who has lost 4 family members over the last year. So every time I see him, he's drinking because he's constantly grieving and he wants to, alleviate the grief, the impact of grief on his life. So he said, so I drink with him because it's more important for me to be connected to my uncle than not drink. And so like that tells us a couple of things about Aboriginal people and social determinants and health. And it tells us that other things are important to us, and like Shane was saying before, we value different things and we really value family connection. We really value connection to country, and we really value the roles that people play in our family and community. And we don't separate those things. So, they're the things that when you're developing programs at a local level, we need to develop programs that build on those valuable things that we've got in our community. A lot of Aboriginal communities have researchers come in and conduct research and then go, and very rarely do we have a nice glossy report that sits on the shelf, but very, very rarely do we actually implement the findings of the research. So what we've found is when we're actually involved in research on a community level and with the university in partnership, that we can actually be a part of the implementation process. So that means for us, a couple of challenges: developing programs that build on the things that people said were important. So every program has an element where we build people's the participants' self-esteem, or we promote the role of Aboriginal people and community, or we promote positive identity, so we develop programs around that. The other thing that's a struggle for us, I suppose, or a challenge, is negotiating that with government, because we're only funded to provide certain types of programs in certain areas. And I think the research really highlighted for me that there isn't a one-size-fits-all approach, that it has to be something that's unique to our community. And so we have to negotiate with government that when we do receive funding for programs, that we're going to do it our way. It's going to be based on the findings of this research. We have the Rumbalara Aboriginal Cooperative, which has been going for almost 30 years, and the Rumbalara Football Netball Club, which has been affiliated with leagues for about 11 years now. It took us about 17 years to get involved with the league. A lot of racism going around in northeastern Victoria at the time, but we've been successfully a part of 2 leagues in the last 11 years. Successfully, if you measure success by the number of grand finals, then we've won a number of grand finals in almost every grade that we put out on the court or out on the football ground. But I suppose the most successful thing that we've done with Rumbalara Football Netball Club is change the way that the non-Aboriginal community view us. So our club isn't just an Aboriginal club, but it's a club that's based on our values and beliefs. So non-Aboriginal people are a part of our club, but they share our values about community and family and being connected. So that's why it's so successful. I mean, that's the place where you can make change on a grand scale in our community. We capture a lot of our community either through their players, their volunteers, their officials. People have different roles in our club. So it's a great place to capture cohorts of people and follow them through. We just completed Drug Action Week last week and got some unbelievable results with some young people, and it's just a fantastic place. You can do all different activities, and we don't have to have that biomedical view. It's a social place, so we make changes on a social level. We do promote that, if you want to perform at your peak, then you need to be healthy and you need to be eating the right foods so you can get, the best opportunity to play. But it's also about being a part of a place where you feel culturally safe. We go to our club, or any other club for that matter, as a group, and we have no fear of other people judging us because we're there together. And that's what our club's about. It's a place where people can come and be, free of racism and stuff. Look, it's not to say it doesn't happen, but we sort of offer a buffer. We protect people. We advocate, for justice, and it's a good place for people to be connected. So yeah, on all levels, it's a win-win situation. Not only for us, but also for the non-Aboriginal community.